to G's Speech Corners channel. I hope everyone is still staying safe and also trying to be awesome every day. I wanted to share this video to kind of talk about what exactly is a speech and language pathologist? Some people, they just aren't familiar with what a speech and language pathologist role is. Some people, they just don't know. So I wanted to do this video to give some insight and background information on a speech and language pathologist. From here on out, I will refer to a speech and language pathologist as SLP. Okay? All right. An SLP, it can be kind of confusing to some people because we wear so many different hats, okay? A lot of people think of a speech and language pathologist as a speech teacher. I get that a lot. Oh, you're a speech teacher, or you're an English teacher, okay? When in fact, an SLP may work in the school systems. They may also work in outpatient clinics. They may work in skilled nursing facilities or nursing homes. They may work in the hospital setting. They may also have a private practice, have their own clinic. So a SLP can work in several different settings and focus and address several different disorders. So with that being said, I started out as a school-based SLP. I'm currently still in the schools, but I've also branched out to having a private practice. So that's one thing that I really love about my field, is that at any point in our lives, we can just kind of change and switch things up and just dibble and dabble in different areas of our profession. I started 7 years ago working as an SLP in the school setting, and then maybe about 3 years into working in the school setting, I started working in the summertime as a traveling SLP. I would travel to Texas. I would stay there during the summer because school was out, obviously. And I worked in 2 skilled nursing facilities. So I had a chance to experience the other side of being an SLP that's not in the school setting. I dibbled and dabbled in the medical side of an SLP. And so I did that for about a year or 2. And then I also came back to Louisiana and started working in the evenings. Once I would leave the school, I would go to the skilled nursing facilities here in Louisiana. And I also worked at an outpatient facility as well. So being in the schools and then working on the medical side, they are very different. Working on the medical side, I experienced being able to work with patients who had strokes. I had a lot of stroke patients, so a lot of them may have had aphasia, which you lose your ability to communicate and comprehend reading or writing. Patients sometimes who have had strokes, they have a difficult time swallowing, eating and swallowing again. So that's dysphagia. So my role then would be to help rehabilitate them and help them to be able to swallow and eat again. So working with those patients, some patients may have had trachs. So anytime you had a patient that had difficulty eating or swallowing, you may have to change their diet. They may have to start out, on a puree level, eating foods, and then work their way up to a mechanical soft diet and hopefully a regular diet again. So being in that setting, I work with the geriatric population a lot. I had patients who had Parkinson's or Huntington's disease, dementia, things of that nature. So it's very, very, very different from the school setting. And then you also have some SLPs who work with the pediatric population, or they may work with babies who were born with cleft lip or cleft palate, which is just a split or opening in the lip or the palate. So that could bring about difficulties eating and breathing and swallowing as well. Those particular birth defects, they can be corrected, with surgery, but you may still need a speech language pathologist. It just depends on how severe the deficit is, or defect is, excuse me. So, like I said, our profession is just so broad, and we cover so many different areas, and a lot of people do not realize that. So now that I've shared that with you, I hope that has kind of opened up your mind a little bit about the role of an SLP. Now, in the school-based setting, an SLP can assess, diagnose, and treat speech disorders and language disorders. And I'm sharing this information about the speech disorders and language disorders to help parents and to also help teachers to understand the difference between the two. And it can kind of help to guide their questions and concerns that they may have, because speech and language are two different things. They are not the same thing, okay? So I'm going to explain the difference between speech disorders and language disorders. And again, this can help parents to kind of, okay, I think my child, may have some issues with their speech, or oh, my child may have issues with their language. And the same thing goes for teachers, okay? So now, with speech, we can focus on articulation, okay, which could be the sounds or the phonemes that the child may be mispronouncing. So, for instance, the word rabbit, the child may say wabbit instead of rabbit. So that's articulation, okay? When you are mispronouncing certain phonemes within the words, and we can help correct that for you or for the child, okay? And I won't get too in depth about the different reasons why a child may have difficulty with articulation. We can talk about that later. Another category for speech could be fluency, or the rhythm or the flow of speech, or stuttering, okay? Another area of concern could be voice, the way that we use our vocal folds and our breath to make sounds, okay? So those are the areas of concern for speech. Now, language. So with language, we focus on a lot as well. Language could be just the vocabulary, the words that we use to communicate our wants and needs. Receptive and expressive skills. Receptive being how well the child may comprehend and understand. Expressive, again, using the words to convey their wants or needs. Also, like I said, just building vocabulary, working with syntax or sentence structures, executive functioning or thinking critically, or your pragmatic skills, conversation skills, turn-taking skills. So language is very broad as well. We look at a lot of things there, okay? So that's just a snapshot. I hope that with that snapshot, that parents and teachers are able to distinguish between the two when they are looking at concerns, and it can also help to formulate questions, appropriately in the correct area of their concern. I hope that this information has been very informative. I hope that you all can use this information. And for the next video, will go into depth with developmental milestones to better assist parents with their concerns. So I will share some milestones and what you should be expecting to see from your child at certain age levels. And that way you can kind of see, is this a legitimate concern, or, is this typical for my child? My child is developing appropriately. So please check me out again next week. Oh, the live story time, our first live story time will be this month, February 23rd. February 23rd. I will be sharing next week in the video the book that we will be reading for our first story time live. So I hope to see you guys next week. Don't forget to read at least 15 minutes a day to your kids, and also don't forget to be awesome, okay? Go out there and be awesome every single day. And I'm out of here, guys.